Welcome back to the Anthropometry session B. Before that, we'll revise in short what we learned in session A. In session A, in anthropometry of the child age group 0 to 5 years of age, the main we see that there are the causes. What we examine is low birth weight babies, then a stunting in the babies, then microcephaly, then macrocephaly. These were the manifestation we saw in the age group 0 to 5 in session A. In session B, we will learn about mainly the wasting, then underweight babies, overweight babies or the obesity. So, in which the wasting is the first criteria we will see in why there is a wasting, what is wasting, how a wasting is a diagnosed, how it can be treated and what are the prevention for the wasting. So, wasting is an indicator of an acute malnutrition. Wasting means what? The baby is losing its weight, and what are the causes? The wasting is defined as the low weight for the height is often indicate a recent and severe weight loss, although it can be persist for longer time. It usually occurs when a person has not had a food of adequate quality and quantity, and or they have had a frequent and prolonged illnesses. So, main cause for wasting is the child is not having enough quantity of the food, or whatever is eating is not of a good quality, and that is for the longer time, and again the child is maybe consistently having some infections, and because of that because of an infection, the fever, the child is not eating and losing weight. The child who loses weight rapidly do not get enough weight relative to his her weight. So, there may be a bilateral pitting edema present in this malnourished child. There we may observe a bilateral pitting edema on the feet. Pitting means what? When we press on the skin, we see a small depression and that lasts for some minutes. So, in children with acute malnutrition are at a higher risk of a death from infectious disease, and they require a treatment based on the severity of their condition. In severe acute malnutrition, there is a need of a hospitalization, and proper therapeutic food may be provided to them to prevent the death. So, acute malnutrition may either be it is moderate acute malnutrition called as a MAM, or a severe acute malnutrition SAM called as SAM. So, depending on the degree of malnutrition, diet such as F75 and F100 are given to the children to help them recover. So, first we have to diagnose this is a moderately acute malnutrition or severely acute malnutrition. So, after the diagnosis, depending on their degree of malnutrition, the treatment is given to them, the diet is given to them. So, initially they are given the F75 formula, and later on the F100 formula is given to these children to recover them faster. Now, what is F75? F75 diet is a therapeutic milk diet that had added vegetable fats, carbohydrates, vitamins and minerals. It is liquid therapeutic diet with an energy density of approximately 75 kilocalories per 100 gram. So, this F75 is a therapeutic milk diet in which added there is a vegetable fats, the carbohydrates, vitamins and minerals to recover the child's requirement. Then F100 diet is intended to be used for the second phase, that is a rehabilitation phase of a children diagnosed with the severe acute malnutrition. So, F75 is a starter formula, however, the F100 is a catch-up formula. So, initially we start with the F75 formula to those children, and later on the F100 catch-up formula, and that can be given for the longer time till the child is recovered completely from the severe acute malnutrition. Now, severe acute malnutrition occurs when a child is a severely wasted and or has a very low mid upper arm circumference, that is less than 11.5 centimeter, and or has a bilateral pitting edema, also called as a nutritional edema. So, child having a very thin arm when its mid upper arm circumference is a less than 11.5 centimeter and the showing a bilateral pitting edema. So, and that edema is called as a nutritional edema. So, this is the diagnostic criteria of the severe acute malnutrition. Bilateral pitting edema is a clinical sign of severe acute malnutrition. Children with severe acute malnutrition are far more likely to die due to infections, etc., than well nourished children. So, such children needs a urgent medical treatment and a specialized therapeutic food to recover. What is specialized therapeutic food? That is F75 and F100 formulas are given to the children. These children kept in an ICU under observation till they recover completely from the severe acute malnutrition. Now, due to poor feeding practices, like a woman lacking the knowledge of proper breastfeeding, weaning, etc., and disease such as a diarrhea, it is now recognized that the young infants are also at a risk of severe acute malnutrition. Mainly this acute malnutrition, the mother who is not having a knowledge of the proper breastfeeding and weaning of the child. So, for a longer time the weaning is not done. So, that time child is not getting a nutritious food and may lands up into severe acute malnutrition. Previously, children less than 6 months of age were considered safe from the malnutrition since they were the exclusively breastfed. Up to the 6 months, the mother feeds her child regularly and multiple feeds given to the child. So, they were away from the acute malnutrition, and severe acute malnutrition is identified in a children from age of 6 months to 59 months of age by assessing bilateral pitting edema and by using the sex specific weight for a length and height index or mid upper arm circumference cutoffs. So, by which you can diagnose the acute malnutrition in children. There is a weight for the age and the mid upper arm circumference. This is all about the wasting. Then we will see the underweight. The child is underweight. Underweight occurs when the child weighs less than would be expected for healthy, well nourished child of the same age and sex. If the two children of a same age and one's weight is very less than the others, when the other child is normal and not overweight, that time the first child is called as the underweight child. So, that his weight is less for his age and sex, that child is called as a underweight child. The prevalence of underweight, that is a weight for age, is less than -2 standard deviation from the median of the World Health Organization child growth standard among children under 5 years of age. So, it is called as the child when is less than -2 standard deviation of the World Health Organization child growth standards, then it is called as an underweight child. Child growth is an internationally accepted outcome reflecting child nutritional status. The child underweight belong to a set of indicator those purpose in a measure nutritional imbalance and malnutrition resulting in the undernutrition assessed by underweight, stunting and wasting and overweight. So, child growth is an internationally accepted outcome reflecting the nutritional status. The child showing low growth on the lower side like a wasting, undergrowth, stunting. So, that is suggestive of the nutritional status of the child. It is an internationally accepted outcome of reflecting the child's nutritional status. Underweight belong to set of indicators whose purpose is to measure nutritional imbalance and malnutrition resulting in undernutrition. So, assessed by overweight, stunting and wasting. So, what is the size of the underweight? If the baby's BMI is less than 18.5, it falls within the underweight range. When the persons, not only the babies, in all persons, the weight, when the BMI is less than 18.5, it is called as a underweight range. When the BMI lies between 18.5 and 24.9, that is called as a normal BMI, and when BMI is 25 to 29.9, it falls within the overweight range, and above the 29.9, the BMI is called as a obesity. When the body mass index, that is the weight in relation with the height, is 18.5 or below that, it is called as a underweight. When 18.5 to 24.9, that is called as a normal body mass index, and when it is between 25 to 29.9, it is overweight, and above that it is called as a obesity, that is a extreme overweight. Underweight for the age, BMI is below the 5th percentile age, gender and height is underweight. Now percentile is taken from it is a statistic measurement of the person. The percentage are taken from the group of the same age and sex when the weight is lesser. So it is observed when the percentile is a 5th percentile or the below the 5th percentile, then for the age, gender and height, it is called as a underweight. When the BMI is equal to greater than the 5th percentile and less than 85th percentile of the age, gender and height, it is healthy. So if the percentile is between the 5th and 85th percentile, it is a healthy percentile. The baby is healthy for that age and sex. When the BMI is at or above the 85th percentile but less than 95th percentile for the age, gender and weight, it is a overweight. So it is another criteria for the overweight as like the body mass index. Now what are the causes of the underweight? Causes of the underweight are the people who are underweight typically are not getting enough calories to fuel their bodies. So calories they required for their daily activities they are not getting. So there is excessive activities of the body, there may be a starvation, there may be malnutrition, and the enough quantity and the quality of the food is not received, the calories are not received. That time they lands up into the underweight. Often they are suffering from the malnutrition. So as they are not getting the good quality and quantity of the food, they lands up into the malnutrition. The causes of the underweight may be genetical, may be born prematurely, that is preterm baby, or the undernutrition. Poor weight gain is not disease but rather a symptom which has many possible causes. So the poor weight gain, it is not a disease. So it is not a disease of any system, it is a symptom which has multiple causes. So not consuming the adequate amount of the dietary energy or the right combination of protein, fat, carbohydrates. Okay. So the person is not having the good amount of the dietary energy, or eating but the combination is not good, the food is not a balanced diet food, and that is why there is a underweight is observed. Then not absorbing an adequate amount of the nutrient. So there may be the child may be having some problem in the absorption of the food. So metabolism, absorption is not normal, and because of which the child is suffering from the underweight, requiring a higher than normal amount of the diet energy. So poor weight gain can occur as a result of a medical problem, a developmental or behavioral problem, lack of adequate food, or social challenges at home, or most frequently a combination of all these. So we observe the underweight in a child when there is a poor weight gain that may result of maybe a medical problem, the child is maybe suffering from a disease, then a developmental or behavioral problem, lack of adequate food, the consumption of the less food, then social challenges at home, and maybe a combination of all these factors observed in underweight babies. The common causes of the poor weight gain for each age, the common causes which are further divided into now in age group, the prenatal, the before the delivery of the baby, the causes of underweight of the baby before its delivery in mother womb, then a birth to the 6 month, then 7 month to 12 month, and over the 12 month of that child. So first we will see the causes of the prenatal causes of the poor weight gain. First, the small for age at birth called as intrauterine growth restriction. The child is small for its gestational age. So it is a low birth weight baby born full term, but it is smaller for his age, and that the cause is maybe intrauterine growth restrictions. Then prematurity, it may be a preterm baby, so born earlier and having a low birth weight. Then prenatal infection with defects, the baby in mother's womb and mother having some viral infections or some medicines, or the mother is exposure to medications and toxins, example anticonvulsant drugs, alcohol, tobacco, smoke, caffeine, etc., that may affect the growth of the baby, and where the baby is born, we observe a baby with a low birth weight and underweight baby. These are the prenatal causes. After that, baby is born, the birth to 6 months, the causes of the poor weight. Now, the poor quality of a suck, the baby is born but not able to suck the mother's milk properly. So, the quality of a suck is not good, and that again causes the underweight baby. Breastfeeding problem, the mother is not having a knowledge of a breastfeeding, she is not able to feed a baby properly, or the number of feedings are also less, and that also may cause the underweight of the baby. Then incorrect formula preparation, even the external, the artificial milk products are given to the baby and the formulas are incorrect, that again may cause the underweight of the baby. Then inadequate numbers of the feeding, the number of the feedings are less and the baby is not getting its nutritional requirement, and the baby lands up into underweight. Then poor feeding interactions, example infant gags or vomits, etc. So the baby having suckling problem and not able to swallow the milk, and also there may be gags, or the baby may vomit the food every time he suck the milk, he causes the vomiting, and so there is no nutritional requirement met to the babies, and that's why the baby lands up into underweight. Then negligence or a neglect, when the not proper attention is given to the baby's nutritional requirement, the feeding of the baby, that time again the child may lands up into the underweight. So birth defect that affect the child ability to eat or digest normally. Sometimes there may be some defect in like cleft palate, okay, and because of which the child is not able to suck or eat, and that lands up into the underweight of the child. So underfeeding sometimes associated with the lack of access, the poverty, or not understanding a dietary needs of the infants. Okay, so this is again what I am telling you, the underfeeding, the baby is not fed properly, the causes are maybe a lack of access, or the because of the poverty, having a no nutritious diet, no formula, the milk formulas are present, and that does not reach the child's nutritional need, and the child lands up into the malnutrition and underweight. Then milk protein intolerance, sometimes the child may have intolerance to milk protein, so that causes either diarrhea or vomiting. So again nutritional requirement of the child are not met and underweight. So the problem with the child's mouth or throat that make it difficult for the child to suck or swallow, as I told you already, there may be a cleft lip or the cleft palate. Then medical problems that affect the absorption of the nutrients, example the cystic fibrosis. Then medical problem that increase the number of calorie needed, example congenital heart disease, gastroesophageal reflux disease, etc. So if the child is suffering from some congenital heart diseases like ASD, VSD, and sometimes the gastroesophageal GARD, gastroesophageal reflux diseases, so that time the medical problem that increase the number of calorie needed for the child, and those calories are not met to the child, lands up into underweight. Then the causes of the underweight in a children in a age group 7 to 12 months. First, the feeding problem. There is a struggle between child and caregiver about what will be eaten. Now here the child is little older, that is about 7 to 12 months, and he has some social understanding, he has some his own choices. So there is a struggle between the child and the caregiver about what will be eaten. The child don't want to eat the traditional milk or milk product like diet, he wants something different, and that's why child don't want to eat these nutritious foods and may lands up into underweight. Then problem with child's mouth that make it hard for them to adapt to chewing or swallowing textured food. Sometimes the oral candidiasis or other inflammatory diseases in the mouth may cause a problem for the child to adapt the chewing or swallowing of the textured food. Then a delayed introduction of the solid food. Sometimes the weaning is maybe delayed because of the lack of the knowledge of a mother about the weaning, and the baby is only kept on the mother's milk, but that is not enough after the 7 month of the child's age, and because of the delaying of the introduction of this solid food, again the child is undernourished and may lands up into underweight. Refusal to eat new food and first offered, so caregiver does not offer again. So when the child is offered with something new kind of the food and the child is not happy with that, so he refuses and caregiver also does not offer it again. So the during weaning, this nutritious food is not given to the child, the child's requirement are not met, the child lands up into underweight. Sometimes the intestinal parasites of this age group, it is commonly find the intestinal parasites, and because of which the child don't eat, or so the child's requirements are not met. Sometimes the child may be having some food allergies, and because of the food allergies, again the requirements are not met with the child. That's why the child of the age group 7 to 12 months again may lands up into underweight. Then the underweight observed in the children over the age of 12 months. The causes are maybe behavioral, that is they are picky or selective eaters, or now they are quite elder, the children, and they become picky or selective about their food. The child easily distracted at meal time, so they don't want to eat the food offered to them and they get distracted, they don't eat, and therefore they remain undernourished. Sometimes they may suffer from some illnesses like upper respiratory tract infection, common cold, and the chronic infections, because of which again they don't eat properly and they don't meet their nutritional need. The new stress at home like divorce, the jobless father, divorced mother, the new sibling, as the new sibling is born, the importance is not given to the first child, then any death in the family, etc. So these are the factors which again affects the attention from the child, and the child don't get its required nutrition. Then social factors like underfeeding related to fear of overfeeding, limiting food choices. Sometimes the mother may be having a fear that overfeeding may affect her child. The child may lands up into overweight. So limiting food choices. These are the social factors. Then a sensory based feeding disorder in children with the developmental disorder, example autism spectrum disorder, then not offered enough food or the right combination of a healthy food. We have already discussed about this, the not offered the enough food or the right combination of the healthy food that causes the undernutrition in this group of the children. Then celiac diseases, food allergies that also affect this age of the group and may cause a malnutrition and underweight observed in these children. So, poor weight gain treatment is, the goal of the treatment is to provide the child with adequate nutrition to catch up to a normal weight. So, the main goal of treating this child is to provide the child adequate nutrition and a catch up to a normal weight. So, by that a child can reach up to the normal weight for his age and sex. So, catch up growth may require changes to the child's diet, a feeding schedule or feeding environment. So, a nutritious diet must be offered to the child, then the number of feeding must be scheduled, and the feeding environment, the good mental environment, the surrounding may be created for the child. The type of the treatment needed depend upon the underlying cause of the poor weight gain and underlying medical problem and the severity of the situation. So, again the treatment is depend upon the underlying cause of the poor weight. So, whatever is the cause, if there is a problem in a suckling, problem in a breastfeeding, there are less number of the feedings are given to the patient. So, number of the feeding must be increased. The dietary contents, the nutritious food must be offered to the child, and the other, suppose there are some social problems affecting the child's nutrition. So, those problems must be removed. These all undernourished children do not require a hospitalization. When the most children who are mild or moderately malnourished can be managed at home, they do not need a hospitalization. Only those who are severely malnourished are usually need a hospitalization initially, while at hospital the child's diet and weight can be monitored. So, nutritional therapy is the primary treatment for the children with poor weight gain. Actually, the main cause of the underweight is the malnutrition or not getting good quality food and the good quality of the food and the nutritional requirement. So, main treatment is giving a supplementation to the child, giving a good quality of the food and its nutritional requirement. So, nutritional therapy is the primary treatment for these children of poor weight gain. Then for infants, number of calories in a breast milk can be increased if it's the infant on a breastfeeding. So, its calories of that breast milk can be increased by pumping the milk, that breast milk, and adding a predetermined amount of formula powder or liquid concentrate. So, all these children who are underweight do not need a hospitalization. If they are mild or moderately malnourished, they can be managed at home by providing their required food quantity and food quality, the required nutritional requirements. But those children who are severely malnourished need hospitalization, and in hospital, that is also in the initial stage, not for the longer period. While in hospital the child's diet and weight can be monitored closely and its daily requirements are given to him. So, as the child recover from that severe malnutrition, then child can send home and treated with its requirement, the nutritional diet at home. So, nutritional therapy is the primary treatment for these children with the poor weight gain, because the main cause of the underweight is a malnourishment or the lack of a good nutrition to the child. So, nutritional therapy is the treatment, and the infants who are on the breast milk having less calories from the breast milk, so that calories can be increased by pumping the breast milk and adding some predetermined amount of formula powder or liquid concentration to that milk, and that is given to the child, so child can get its required calories. Then infant between 0 to 4 months require frequent feeding, typically 8 to 12 per day. As these infants are growing faster, they have a more requirement of the calories for their organic growth, and therefore the number of feeding must be more during this time. The older child should be eaten every 2 to 3 hours, but not constantly. If the child is older, so he can eat on every 2 to 3 hours, but not continuously. Then the next point observed by the anthropometry in children is the overweight and obesity. After the underweight, overweight is again a problem observed in the children. Now, overweight and obesity occurs when a child has too much body fat and weight more than would be expected for a healthy child of the same height, age and sex. So, this is the emerging problem nowadays observed all over the world. Instead of malnutrition and underweight, nowadays we observe the overweight and obese child everywhere. So, this is the emerging problem all over the world, where the child having extra weight, the much fats is a body and more weight that is related to the other children of his age and sex. So, overweight and obesity are complex condition with the multiple causes, including an imbalance between calorie consumed and calorie used. Now, initially in underweight we saw there was a much requirement of the calories and the less calories were consumed. Here the requirement of the calories is less and the calories are consumed more, and they are not utilized, and because of the low level of the physical activities or some medical conditions, some genetic factors also, that also causes the overweight. So, childhood overweight or obesity associated with health risk in childhood and adulthood. So, those children who are overweight in their future, in their adulthood, they may suffer from some other diseases, and so like type 2 diabetes, asthma, high blood pressure, stroke, etc. So, overweight obese are more likely to become overweight adults. The child who is overweight in adulthood, he may remain the overweight adult, and they are also at increased risk of poor health outcome because of this child in the future in its adulthood may come across the other risk factors of the poor health associated with the adult obesity, being overweight, like diabetes mellitus, heart disease, cancer, stroke, etc. The overweight obesity in children from birth to 5 years of age is identified by using the BMI for the age and the index for weight for length or height index specific to that child sex. So, this overweight is diagnosed by using a BMI or by measuring the BMI of that child. As the underweight is a problem, the overweight is again a bigger problem in a children. So, those children who are overweight in their childhood may suffer from the some diseases in their adulthood also, like as I told you earlier, the diabetes, the heart disease, the cancer and stroke. So, this is area of the concern in obese children. The measurement and indices used in a children age group 0 to 5 years. Now, we in a session 2 we learn about the underweight children, overweight children, wasting in the children, Okay. In session A, we learn about the stunting, microcephaly, macrocephaly, and low birth weight. These all diseases in the children, or these all factors in the children, are observed and diagnosed by using the anthropometric measurements. And we know the anthropometric measurements used are the height of that baby for his age and sex, weight of the baby for age and sex, then head circumference, then mid upper arm circumference, then the waist circumference also can be measured, the abdominal girth can be measured, the shoulder length, limb length. So there are multiple measurements can be taken for the diagnosis of certain diseases in the children, or to observe the growth of the baby is having a normal growth or not, okay, or there is a overgrowth also. So some of the anthropometric measurements and indices used for children between the age group 0 to 5 are the weighing scale. When the baby is born, on the first day, in the first few hours, the baby's weight is done. Okay, so you can see in this picture, this is a electronic machine on which the baby can be weighted. So this is a digital electric weighing scale. Okay, so which gives the more accurate weight of the baby and has a high durability than the other weighing machines compared to this machine. The birth weight is measured from soon after the birth to within first 24 hours after the birth. This is the disadvantage of this machine is only it needs electric connection. So when there is a no electricity, though you cannot use this machine, that time we have to go for the traditional weighing machine, the mechanical weighing machine. Now weight for age. The weight for age consider a child's weight relative to his her age and sex. So this is an anthropometric measurement of weight for the age. So weight for age considers as a child's weight relative to his or age and sex. It may reflect wasting, stunting, or both. So from weight you can diagnose there is a wasting or stunting, or both are present. So its usefulness is limited as it cannot differentiate between the wasting and stunting. So by weighing you cannot differentiate that the child is suffering from the wasting or child is suffering from the stunting. Then weight for length or height identifies a child whose weight is too low for his or length or height. So by weighing the child from his weight, we can diagnose only that the child's weight is normal for his height and sex, or it is on the it is on the lower side. So it reflects wasting or overweight obesity of the child. So from weighing we can diagnose the wasting or the baby is overweight or obese. Then another measurement is length and height measurement. After the weight we measure the child's length or the height. The length or height of the age considers child's height or length in comparison with his her age and sex. It is used to identify stunting or chronic malnutrition. So by length we can diagnose the stunting if the height is less than the normal height for that particular age and sex. So we call it as a stunting that we may observe in a chronic malnutrition. So length is measured by child lying down and is useful for children below the age of the 24 months. So the child less than 2 years we measure it in a lying position or in a recumbent position. The height is used for children above the age of the 24 months. So height that is measured in a instrument in a standing position. So that when the child is more than 2 years of old we can measure his height, and length by lying down or in a recumbent position measured. So on this slide you can see this is a infantometer where the child is lying on that meter and you can measure the child's length by adjusting the foot plate of the child. So this is a very useful in measuring the length of the child below the 2 years of age, and this is the instrument which shows the weight as well as height. So this equipment measuring both height and weight of the children. You can see this is for the child weighing more than having an age more than 2 years. So, the child can stand up on the machine, or you can see at foot plate there is a weighing machine on which you can observe the weight of the child, and the adjustable plate is on the head, which gives us the measure of the height of the child. Now, BMI for age, this is another measurement which is a very useful in diagnosis of wasting, overweight, obesity and the underweight of the child. Now, the BMI, that is a body mass index for age, identifies both wasting and overweight. It is a ratio of weight relative to length and height. The body mass index is it's a ratio of weight of the child or the person to its height or length. It is calculated by using the formula, that is weight in kilogram divided by the height or length in meters square. During interpretation, the age and sex of the child are necessary, since this age group is still growing pretty rapidly. So, BMI gives us idea about the wasting, child is suffering from the wasting or overweight or obesity or underweight, and the formula of the BMI is the weight in kilogram divided by length in meters square. The another measurement of the anthropometry, we examine the child to diagnose the malnutrition, especially in younger children, that is mid upper arm circumference. It is used to identify wasting, that is acute malnutrition in children the age group 6 months to 59 months. By measuring the circumference of the mid upper arm and comparing it to the standard cutoffs. Initially it was used for screening only, but it is also used for diagnosis, admission and discharge of the children. So, initially it was only used for the screening of the children, the child is well nourished or malnourished, okay. But now it is a very useful equipment for diagnosis of the malnourishment. So, it is a mild or moderate malnutrition, or it is a severe acute malnutrition. So, by which we diagnose it, we decide the admission of the baby, or by continuous monitoring the mid upper arm circumference, observe the prognosis of the malnutrition, and accordingly we decide when to discharge the children from the hospital. So, it is a simple measurement and a good predictor of the risk of the death. Now, in this slide you can see in the upper corner there is a one red, yellow and a green plate that is called as a Shakir's measuring tape, which is encircled around the arm for the measurement. So, when we see the measurement in a red area, that is less than 11.5 centimeter, the child is suffering from severe malnutrition. When it is between 11.5 to 12.5 centimeter, the measurement of the mid upper arm is between 11.5 to 12.5 centimeter. The child having a risk of malnutrition, means there is a malnutrition, but it is not a severe, it is between the mild to moderate. When the green part of the belt between the 12.5 to 13.5, there is a risk of acute malnutrition, like it is a mild malnutrition. And when it is above 13.5 centimeter, the child is having adequate nutrition, so that is a normal range. So, when the mid upper arm circumference is a more than 13.5 centimeter, that is called as a healthy child. So, it is not a malnourished child, but less than that suggestive of either it is a mild acute malnutrition, maybe a moderate acute malnutrition, or if when it is less than 11.5 centimeter, it is called as a severe acute malnutrition. So, this is a very important equipment in a diagnosis of the malnourishment. Then head circumference for the age, this is the another measurement we do through the anthropometry. The head circumference for the age compares a child's head circumference measurement to the expected circumference of the same age and sex. Associated with the brain volume, head circumference is affected by nutrition during pregnancy and during the first few months of the life. So, this makes it very useful in assessing the neurological and developmental deficit in the babies. as we have already studied about the microcephaly and macrocephaly. So, we have seen that the causes of the micro and macrocephaly. So, diagnosis of this microcephaly, macrocephaly can be done by this head circumference measurement. And so, for that you can see in the slide, this non-stretchable tape is used for the measurement of the head circumference. The edema is a sign of a malnutrition, and we observe it mainly in a severely acute malnutrition such as in a kwashiorkor, in a marasmus, so that is called the nutritional edema. The edema, what is the edema? It is an abnormal accumulation of the fluid in the subcutaneous tissues, the interstitial spaces of the body, and that causes the swelling. So, in this case the edema begins on the feet, and because of the less protein, there is increase in the permeability of the vessel wall, and that allows the fluid from the intracellular fluid to enter into the extracellular spaces, and that we call it as a edema. So, it is characterized by lasting pitting edema. So, when we press anywhere on the swollen part, it shows the indentation or small pit that lasts for the some time and then it disappears. So, lasting edema of the skin when pressure is applied to both feet for 3 seconds. If we press in somewhere on the feet for more than 3 seconds, it shows the pit, and that is called as a pitting edema. So, even mild bilateral pitting edema indicate severe acute malnutrition or another serious medical condition. So, this pitting edema is not a good sign in children. So, these cases must be referred for the further assessment and treatment. So, when we observe the edema, so we have to do further investigation to rule out the child is suffering from the malnutrition or any other systemic diseases. So, interpretation of anthropometric indicators and classification of nutritional status. Whatever investigations we do in anthropometry, the measurement we do, so their interpretation. So, for children from birth to 5 years, the World Health Organization Child Growth Standard provides a guidance for interpreting most of the anthropometric measurement and indices described so far, including cutoffs to classify children's nutritional status. So, World Health Organization has given some charts which gives us the normal value of the child's height, weight for a particular age and sex. So, by reference of those charts, we can decide the various problem in the child's growth during the age of 0 to 5 years, as like the child is suffering from the low birth weight, the child is underweight, overweight, obesity, having a microcephaly, macrocephaly, stunting, so or malnourishment. So, that can be diagnosed by using those charts. In India also we have a various systems of classification, and that are used to classify nutritional status of the child based on the standard deviation. So, there are some chart I have placed here where it shows. Now, in this chart you can see the male baby age group from 0 to 11 month. So, on very left side you can see the age group 0 month to 11 month, then weight for 0 month, that is very first month of the life, the weight is from 7.4 pound to 3, that is in kgs 3.3 kgs, that is weight, and length is given in inches and centimeter, that is 19.6 inches or 49.8 centimeter. Likewise, for every month for a male baby, the weight and length is given in this chart. So, this is a normal weight for normal height of the baby for that particular age, that and the sex is male. Similarly, this is a chart for the female baby, and here again the age group, that is 0 month to 11 month, the weight is again 3.31 kg on the first month to 9 kg, about 9 kg on the 11th month. So, there is a growth of weight about 6 kg during this period, and the respective length is given in the length chart for that weight for the particular age and the female sex. Now, this is a chart again the age group between the 12 months to 23 months. Again the weight in kg and in pounds, the length is in a centimeter and inches in this given chart. This is for the male child and this chart is for the female child. So, these are the reference charts we can refer to rule out the baby having a normal weight for that particular length for particular age and sex. Now, this chart is suggestive of the weight for a length of a boys, that is for the male child, the age group between 0 to 23 of the months. But this chart is showing us is there is a severe acute malnutrition or moderately acute malnutrition, the child is overweight or obesity along with the normal range. So, this is a very good reference chart where we can diagnose the again the same thing, the age, the sex, the length and weight, and along with that here the ranges are given to diagnose it, the severe acute malnutrition or it is moderately acute malnutrition or it is a normal range or overweight or obesity. So, this is a very useful chart, again the same kind of the chart for the girls of the same age 0 to 23 months, then boys from 24 to 59 months, and again this chart is for girls for 24 to 59 months of the age group. So, by using this chart we can diagnose the child is suffering from either low birth weight, any malnutrition, obesity, overweight. So, these are the very useful chart. By this all we come to know that the anthropometry is a very useful in a diagnosis of the malnutrition in a children, the low birth weight in a children, the stunting, the microcephaly, macrocephaly, overweight, underweight and obesity. So, by measuring the height of the baby, weight of the baby, the head circumference, the mid upper arm circumference, then BMI, these all measures are very useful. Anthropometric measures are very useful in a diagnosis of certain growth patterns in a children. So, I hope you have understood about the anthropometry in an age group of 0 to 5 years of age, and we can apply this knowledge while when we practice, and we can diagnose these cases as early as possible and help them to recover from their problems. Thank you very much. Thank you.